The starting point is that we need a more expansive understanding of social protection. We understand it in terms of our research as a sub-component of social policy, and that especially in the context of food security and malnutrition or nutrition, to go beyond the current, what I'll call obsession with social transfers, safety net social transfers in cash. For one thing, usually the amount provided in many of these transfers are very small. Estimates in many of the countries is that in some cases they're in fact less than the daily price of a loaf of bread. And the other is, of course, that they are easily eroded by inflation, and especially in the context of drought-induced food shortages. So if we have a more expansive understanding of social protection and in relation to this social policy, and we understand it in terms of human well-being, what nutrition indicates, or malnutrition indicates, is in fact a very severe threat, placement of human well-being at risk. So an expansive understanding of social protection becomes quite important in terms of protecting human well-being, but particularly in the case of child malnutrition, with its enduring and long-lasting impact on cognitive capacity, learning, ability, and future, productive capacity. It becomes important to address this, at what do you call it, maternal level and child nutrition level. Nutritional impairment, especially in the early childhood, as I indicated, has a significant and long-lasting implication. And in that regard, and coming back to what I said earlier on about having a more expansive understanding of what do you call it, social protection. We've in our research, emphasized, a broader understanding, which should include, for instance, land and agrarian reform or production support. In that, what do you call it, agrarian production, supports knowledge, finance, seed, agricultural infrastructure, especially for small holder producer. Is important for food security and food sovereignty, and this is particularly important in the African context, where we've had the significant erosion of food sovereignty and nutritional adequacy for a few decades now. And in that regard, infrastructural support becomes quite important in terms of shifting agricultural production away from being rain-fed, rain-fed production. We know that with stable income, for instance, and I'm emphasizing this because we know that in the rural areas, nutritional impairment is particularly more significant, issue in terms of threat to well-being, and a stable, income for farming households, for instance, in terms of, as a result of agrarian support, tends to smoothen consumptions throughout the year and enhances asset accumulation. Our own research demonstrates that the quality of agricultural reform, land production, marketing support, enhanced well-being of beneficiaries. And then, of course, the second point is that there's a need for us to shift our understanding of social protection towards what we will call a prophylactic, approach, to social protection, rather than responding to vulnerability. In other words, an understanding that seeks to prevent vulnerability rather than responding to vulnerability. I can come to other components of this later, especially the centrality of understanding the link between social policy, social protection, and macroeconomic policy, which creates or deepen or can remove vulnerability. And I will argue that the three, top critical policy bottlenecks are ideas, interest, and power. Because ideas and interest and power drive what we consider to be possible, to be affordable, to be sustainable. When I look at the terrain, for instance, in terms of provision of something as simple as education, when I was growing up in Western Nigeria, and look at the state of the provision in the same context, it's dramatically different. What we've seen is a situation where the idea of public provisioning and collective understanding of the protection of human well-being, both in the immediate and in the future. And here, education is not just at the level of, guaranteeing future productive capacity, but it also becomes the platform, the framework, the context for nutritional, paying attention to nutritional, status of learners. In some other context, in terms of their health status. So school feeding becomes quite, important in many areas, but context where we took for granted that the children of the gardener and the children of the minister can be educated in the same classroom is something that has gone away, over the years. And the same thing is at the level of ideas about what we consider possible. It's ideas, for instance, and interests, particularly, drive different types of macroeconomic policies that increasingly financialize social policy. So on the one hand, we talked about provisioning through safety net. On the other hand, we have a situation where, the same macroeconomic policy creates the environment that deepens the vulnerability that we're supposed to be addressing. In terms of the five, frameworks of adequacy, coverage, comprehensiveness, quality, and responsiveness in terms of degree. If you look in terms of, Mauritius will probably be the closest thing that we'll look at in the African context. But even in that particular context, there are rooms for improvement, and this is where the issue of adequacy, comprehensiveness, quality and responsiveness isn't aesthetic comparative thing. It's an aspiration, an extension that we strive towards, all the time, and therefore continuously evaluate, continuously assess, and continuously improve enhancement of creating an environment of quality well-being for all.